So the ones, at least the most commonly used commercial panels that I'm familiar with and that I tend to kind of consider using in my practice are Invitae's panel, Myriad's MyRisk panel, and GeneDx's panel. And they're all different somewhat in a few of the genes that they cover, in the turnaround time that they give, and in the most particular thing I think that the real difference is what each individual company's annotation of their genes are. What I mean by that is that, say, Invitae may have different annotation for their deleterious mutations that Myriad may have. And so for that reason, I think it's important when someone looks at these panels that they ask, what is your percentage, for example, of variants of unknown significance? I mean, that's really the key here, is that we're going to find a lot of variants. A lot of them we have no idea what they are. I mean, maybe if you had some experience in molecular biology and kind of guess as to what that mutation is, but a lot of us don't have that experience. So we really have to kind of trust what each individual company has done in terms of the annotation of their variants of unknown significance. And I think that's probably the biggest thing that separates a lot of these companies, aside from turnaround times and cost. That, to me, I think, is really the big one.
When they're putting together panels for genetic testing, they typically include genes that have different roles right now in our understanding of hereditary breast cancer. Obviously, there's BRCA1 and 2, highly penetrant genes where specific mutations have been identified that predispose to cancer and where we have a lot of background information. Then there are these rare genetic syndromes beyond BRCA1 and 2. We've mentioned them briefly: Li-Fraumeni syndrome, hereditary diffuse gastric cancer, and lobular breast cancer, where we have a specific gene in mind, and if you find an abnormality there that tracks with the family history, you have a good insight. The next wave of genes include a variety of tumor suppressor genes and other genes that have identified on large screening of large numbers of cases, PALB2 and CHEK2 and ATM, and which do clearly seem to have a role in the development of breast cancer, but where the penetrance is a lot lower and may be affected by other background genetic information that isn't fully testable or known at this time. So instead of an 80% lifetime risk for breast cancer, some of these will have a much lower lifetime risk, say 30%. Well, that would still be twice the average, but it doesn't mean that you're necessarily destined to develop breast cancer. So the first thing to say is that when you start adding lower penetrant genes, it makes the decision making afterwards more complicated because it's harder to tell the patient what she should really expect in terms of what her risk is. The second is that mutations in these genes often come scattered through the genes, and some of them are clearly pathological mutations, and some of them are these variants of unknown significance. For, again, BRCA1 and some of the BRCA2 and some of the other hereditary syndromes, we have a pretty good idea of which the significant mutations are. For these other lesser penetrant genes, it's not immediately so obvious where the mutations that are problematic lie. The third is, how would you manage such patients? Would you do prophylactic surgery? Would you do surveillance? And again, we have a lot less information for some of these less penetrant, less frequent gene mutations. So that's where I think charting the information becomes really helpful, and patients are going to have to learn to adapt to a situation where you're going to acquire information and then more meaning for that information, more for that genetic data will emerge over time as we continue to build these. In terms of the actual platforms, there are a bunch of companies that are developing several of these panels. For the most part, the quality of all of these has been excellent, and the actual genetic testing is something of a commodity. It's not technically that hard if you run a genetics lab to do this. What really features into it is putting the right panel together for a specific patient, because there are patients where you want to look at one set of genes versus another. There should, in theory, in a free market, be some price competition between these, and that may affect the choice that people make. And then finally, some of the companies have done a really good job of building up a repository of the genetic information to help actually explain what the mutations mean, and that's another value-added product that some of the panels come with.
When we're faced with all these choices of different companies for testing, it's a complex decision-making. And I think for me, speaks again to the concept of having genetic specialists involved, because honestly, as a clinician, that's not something that we have a lot of experience with and a lot of background in. The companies differ in terms of some of the techniques that they use and some of the things that we really want to be aware of. is, what do they do if they find a variant? How robust is their system for identifying whether that variant is truly a deleterious mutation or if it's a variant that is inconsequential, a benign polymorphism, or if it's a variant of uncertain significance. And if it's a variant of uncertain significance, what are the techniques and how do they manage things in terms of reclassifying that variant? How would they approach that? If a deleterious mutation is found, if the company is doing next generation sequencing, which is what most the multi-gene panels are done by doing next generation sequencing, typically the companies should then use a second methodology, often Sanger sequencing, to confirm that mutation. So those are some of the other things that go into it. The depth of coverage, a variety of things that really, that's again for me, as I mentioned previously, one of the reasons that I rely so much on our genetic counselors to help us with this, to help us figure out which companies are really the reputable companies who have the depth of experience in this and who really use stringent techniques for assessing the findings from the testing.